Now, you'll actually be able to see this in action, the actual practice of this, and then you'll be able to do it as well. Now, the way this is going to work is this. I'm going to start the process off and say, okay, here's what I'm going to do. What do you think I should do next? Now, when I say, what do you think I should do next, or what do I do next, I want you to sort of fill in the blank. See if you can give the answer before I say the next step. So try to give the answer before I go to the next step. Because then, when the testing part happens, you're going to have to do just that. And so I want to make sure that you get the practice in, okay? So let's try this out. Here's the situation. I have an adult laying on the floor. There's an adult laying on the floor here. I come into the room. The scene is safe. The scene is safe. I come into the room and I find this person laying on the floor. What do you think I should do first? The first thing I'm going to do is I'm going to gently shake them and shout in their face, are you okay? Are you okay? Are you okay? Now there's no response. What do you think I should do next? Right, if they don't wake up, the next thing I'm going to do is I want to call 911 immediately. I want to activate EMS. I'm going to point to someone and have them call 911, or I'm going to get up and call 911 myself. Once I've called 911, what do I do next? Next, what I'm going to do is the ABCs. The first thing I'm going to do is I'm going to open up their airway. I'm going to open up the airway by doing what? It's called a head tilt chin lift. Simply one hand's on the forehead, one hand's on the chin to open up the airway. Once I've opened up the airway, the next thing I'm going to do is I'm going to check for breathing. I check for breathing by getting right down there. I'm going to be doing three things. I'm going to be looking, listening, and feeling. I'm going to be looking for the chest to rise and fall, and I'm going to listen for air against the side of my face. Now, how long do I check for breathing? I check for breathing for 5 seconds. So I check for breathing for 5 seconds. Now, if they're not breathing after 5 seconds, what do I do next? I give 2 breaths. I'm going to pinch the nose because I don't want to get anything on my face. I pinch the nose and I'm going to give 2 slow breaths. Now that I've given 2 breaths, the next step I'm going to take is what? I'm going to check for their circulation or pulse. I'm checking for their pulse. Now I'm going to check for their pulse for about how long? I'm going to check for their pulse for about 10 seconds. 10 seconds. So I'm checking for their pulse for 10 seconds. Now at this point, they actually have a pulse. So if they have a pulse, that means that the heart is actually working. So if their heart is actually working, I don't have to give them compressions. But I still need to do what? I need to give them air. This is what we call rescue breathing. When somebody has a pulse but they're not breathing, I'm only going to give somebody rescue breathing. Rescue breathing is 1 breath every how many seconds for an adult? 1 breath every how many seconds for an adult? 5. So it's simply going to look like this. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And I'm going to do this for about how long? I'm going to do this for about a minute, and then I'm going to go back to the A, B, and C's. So that's rescue breathing.